Hello, bienvenidos a todos. Здравствуйте, namaste, mes amis, bonjour. Bienvenue à IFL-SC Global Academy. Welcome to your global platform for leadership, for education, for communication, for health, for diplomacy, of course, for health education. I am Marie, and today I am pleased to take you into one of the most controversial, fascinating topics that affect you and I. That's right, it's a topic that many dread, but I want to tell you that that's a topic that can literally save your lives. I said statistics and data. Yeah, I said so. So grab a cup of coffee and relax, and let me take you into the journey of how numbers can really save lives. This is very important because a lot of people dread mathematics, they dread numbers, they dread data and statistics. I was one of them in the past, but that's in the past. But right now, I'm free from that because I now understand that numbers and statistics can really save people's lives. And that's why they are very important. It's very important to take a good look into that because these are things that can save your life and even save the life of people around you. And data and statistics actually can bring about development. Did you know that? And we on this program on IFL-SC Global Academy, we're very passionate. We love anything that has to do with development. And that's why we look at that in this program. We're going to look at how statistics are linked to development. Is there any connection? Yes, there is. How can data, how can statistics really save lives? Remember that our purpose on this program is to serve God and to serve humanity through the great agenda. You can see the great agenda is what we do here. G for gender equality, R for reality into action, E for education, A for action for climate, and then of course T for training for the future. That's what we do on this show. Now, let's dive right into it. I told you some time ago that if you follow us on this channel, you'll be able to learn at least three languages. I'm not lying. Today, we're going to look at a few other concepts in Spanish, in French, and in Latin. We're going to learn three languages today. So, how do you say statistics, for instance, in these three languages? Now, in Spanish, you say estadística, estadística. In French, statistique, les statistiques. In Latin, you say statistica. Okay? Now, how do you say data in Spanish? In Spanish, you say datos, datos. In French, you say données or les données. That's in French. In Latin, you say data, simply data. Now, how do you say health in Spanish? Health in Spanish simply salud. And in French, santé or la santé. French people, they always put an article, la, le, le. So la santé. And then in Latin, what you say is sanitas. You can say sanitas or you can say valetudo. It's the same thing. Now, how do you say biostatistics? Biostatistics is a very important word. Biostatistics in Spanish, you say bioestadística, bioestadística. And in French, you say biostatistique, biostatistique. In Latin, you say estadística biológica. Okay. Now, how do you say survey? Another very important word in research. How do you say survey in Spanish? You say encuesta, encuesta. In French, you say enquête, enquête. For instance, you say les enquêtes. Nous faisons les enquêtes. So we're doing an investigation. Now, in Latin, you say circumscription, circumscription. Now, another very important word in health, disease. How do you pronounce that in those three languages? In Spanish, you say enfermedad. Wow, what a word. Enfermedad, disease. In French, it's simple, maladie. If there are many, say les maladies. Or if it's one, you say la maladie. And then in Latin, you say morbus, morbus. Wow. You see, those are very important words that if you master them in the three languages, and a lot of health terminologies actually stem from Latin. So if you know Latin very well, all those complicated terminologies in medicine and all of that will be very, very easy for you to understand. Now, have you ever wondered where the word statistics come from? Now, it comes from Latin, of course, I told you. It comes from the Latin word status. Okay? It also comes from the Italian word statista. Now, those all those words, status and statista, mean state, because originally statistics was used to collect information about the state, okay, like the population of the state, like taxes, military strength, and all of that, all those kind of things, governance data for the state. Now, as time went on, what happened? It evolved into a science of understanding data, not just for counting things. Now, in our advanced world of today, statistics is now referred to as the science of not just observing, but also collecting, analyzing, interpreting, and presenting data. That's it. However, in health, it's another form. It has another meaning. When you talk about statistics in health, we often refer to the branch of statistics that is called biostatistics in health. And so, what's biostatistics? Biostatistics is simply a fusion of biology and statistics. So, it refers to the application of statistical method in biological and health sciences. So, when you apply statistical methods to biology and health sciences, that's what you call biostatistics. Okay? Just like the word data, the data is a plural and the singular is what? Datum or datum, as some would like to say. So, which means it's just a given fact or a piece of information, a piece of point, just a singular datum. So, when we gather many data points, we can find patterns and make meaningful conclusions from those data points. So, data and statistics are kind of similar, but they are also very different. If you look at the similarities between data and statistics, you find out that they are both they both deal with information, because when you talk of data and statistics, it has to do with information. They are both used for research. They are both used for decision making. Data and statistics both depend on each other, because you can't have statistics without data, isn't it? And also, data and statistics both can be quantitative, can also be qualitative. They have a lot of similarities. Now, so what are the differences between data and statistics? Data is what you call the raw facts and figures. That's data, the raw facts and figures. I mean, the raw material, the unorganized material. And the purpose of data is to be analyzed, is to be studied. Whereas statistics is already the processed information. Okay? It is an organized summary of data, the finished product that helps you understand and communicate what data means. So you see that statistics is organized, okay? It's organized, it's interpreted. And then the purpose of statistics is to explain or to describe the data. Now, think of it like this. I like to give this example to the lay person out there who doesn't know much about data. Now, data is like the ingredient, and then statistics is like the cooked meal. Okay, look at it like that to understand very easily. So, and when you look at that, you find out that there are two major branches of statistics. We have what you call descriptive statistics, which deals with summarizing data. Think of things like charts. Each time you see a chart, it has to do with descriptive statistics, averages, percentages, pie diagrams, and all of that. That's what you call descriptive statistics. And then we also have inferential statistics. Now, inferential statistics helps us to make predictions, to draw conclusions from the data that we have, that we've gathered. Now, what is the type of data that I found that you can find? You can find what you call qualitative data. So when each time they talk about qualitative data, it has to do with categorical data. That means data that describes the qualities or the categories of something. Let me give you an example. If you talk about gender, gender has to do with male and female. That's qualitative data. It categorizes into male and female. We talk about blood group, for instance. Blood group, you have the A group, you have the B, you have AB, you have O. It's categorical. And then we have what you call quantitative data. So when you say quantity, it comes from quantitative, which means numerical. There's a number attached to it. These are numbers you can count and then you can measure. Now, example, your age. If you're 30 years old, that's quantitative. Or if your blood pressure is 120, that's quantitative. Or if your weight is 60 or 30 or 65 kg, it is quantitative. So where does data come from? You may want to ask. Well, data comes from things like surveys. The community can, want to find out about the numbers, the health survey, carry out the health survey, get data from that. Data can come from experiments. It could be in a clinical trial in a clinic. It can come from medical records in hospitals. You know, hospitals have large databases. So data comes from there. Data can come from government reports like census, national health reports, and all of that. Data can even come from interviews or focus group discussions. It's possible. From an interview, you have data from there. Those are all sources of data. Now, this is where things get a little bit exciting for us on this program. How do statistics help in development or health development? All these things we've seen, data statistics, are they helpful to help development? Well, before I tell you how, go down there, subscribe, like, share the video, well, give us a comment. What do you think? How can we use data in development of Africa? What's your point? Now, health data is very important in development because, first of all, such data can be used for disease surveillance. You know, we can track trends in diseases with data. For instance, when there was COVID-19, the spread of it was being tracked, you know, especially in this part of Africa where malaria is so prevalent. You can actually track and survey the outbreak of malaria. Now, data can be used for evaluating treatments. Very important. We use randomized control trials and data analysis to find out which treatments work best for which type of cases or for which population. Now, data is very important in health planning as well. You want to know how many vaccines to buy for the population. You want to know where to build the next hospital. You'll need data for that. Now, risk prediction. Statistics help us to predict who is more likely to develop diabetes, hypertension, or cancer. Okay, right? So that you can act early. Will you go to a nursery school and carry out a research on hypertension, diabetes, and cancer? No, because the data already tell you the group that is easily affected by those diseases. So you won't waste your time going to a nursery school to try to test for hypertension, cancer, and all of that. So you see how data is important. Data is very important for public health campaign because statistical analysis helps measure the impact of health programs like vaccination campaigns or HIV prevention programs. That's very important. But you find out that those of us who live in this part of the world, in the third world region or in Africa, we find out that Africa still has a challenge in the preservation, and the use of data. Because gathering data and accessing health statistics and information, especially in many low income countries, can really be very difficult and complex. It can be very complex. For instance, there is lack of reliable data collection system. Many regions today lack structured health information system, HIS, which we call the HIS. So there are a lot of countries who don't even have that structured health information system. Paper-based records are still used in many places. Instead of using information technology, a lot of countries are still using paper-based records systems, which have proven to be filled with errors, can even be lost, and a lot of inconsistencies. Now, there is poor infrastructure in this part of the world because inadequate internet access, you know, before you even have internet, not to talk of electricity or digital tools for you to enter the data. It's not there. How do you store data? How do you analyze data if you don't even have the basic electricity? So those are some of the health challenges. A lot of facilities lack these basic computers, even basic computers to manage the data or even store the data. Now, another issue is a shortage of skilled personnel. I can tell you that for free. There is a lack of trained staff in some of very, very specialized areas. Now, you look at an important area like biostatistics. How many biostatisticians do you find in this part of the world, in so many developing countries? Because these are people who can come up with this data we've been talking about, the data that can save lives, biostatisticians. That's their job. Now, how many health informatics officers do you find around here to collect, analyze, and manage the data? Very few. So that kind of personnel, specialized personnel in these areas is still lacking. So health workers are overburdened and many don't have time or even the training to properly record health data. You're not going to be telling the doctor who's trying to save a life, who's kind of maybe a surgeon who's trying to carry out an operation to now sit and be recording data and preserving data. No, they are overburdened already. Too many cases and too many problems. So they cannot be involved in data preservation and management. So people have to be trained to do that. Okay, you know that there's an existing even problem where this debate is still ongoing in Africa, where some people feel that if you're a clinician or you're a doctor, you're specialized in saving lives, or you're a surgeon, you don't need to bother yourself with management, okay, hospital management and issues of management and leadership and administration, because these people sometimes are not good administrators, not of their making. It's just that they are trained to save lives. They're trained to work in high tension periods in times of emergency. So they're not administrators. So they find it difficult to get involved in basic administration. Now, even the data that is involved that you can find today is even fragmented. It comes from fragmented sources of data. You even find we have issues with data quality, and then even the access to that data that is found is problematic. For instance, if you're a researcher and then you go to a private clinic or even a public clinic and you say, oh, I need data on so disease, how many persons are, it's difficult for people to release that information to you because of issues of privacy, issues of confidentiality concerns. They are there. So some researchers find it difficult to access that kind of information. Now, there are also issues with cost of data collection. Wow. The moment you identify a problem or you observe a problem, and as a researcher, you think it is good for you to research, to get into research to find out the cause of the problem. And then you draw up a budget for that research. You find out that your first limitation will be that budget because there is no money. By the time you look at the cost, oh, why should I even embark on it if I don't have the money to? So, cost of data collection is usually a very huge hindrance to researchers. And of course, you have issues of instability and conflict. If you are in a country that is volatile, maybe herdsmen are kidnapping people, or there is unrest, there is a civil war, or there is militancy, or what have you, there's a lot of instability. So issues of instability will make a researcher not even want to venture into data collection. But why does this matter? It's very important that researchers get reliable data. This is very important because health authorities cannot plan, they cannot allocate resources or respond to disease outbreaks effectively and efficiently if there is not qualitative data. Policy making, research, and funding decisions become based on guesswork instead of evidence. That's very misleading. So investing in digital health system becomes the solution. It becomes very important that leaders today, policymakers, decision makers, politicians should, as a matter of urgency, look for possible solutions through investing in digital health system, training health personnel on data collection and management, establishing national health observatories. That's very important. They can even promote and open data policies with strong data protection laws. This is very important, okay, for our health system. Even today, it's very important to strengthen partnerships between the government, the academia, and the NGOs. The government should not exist, should not think that, okay, I'm government, I just oversee. No, the government should try and find this partnership, this link between the government, the Ministry of Health, the teaching hospitals, the medical universities should have that understanding because there's always an ongoing conflict between the Ministry of Health, between the Ministry of Education, the teaching hospitals, and the universities. That conflict is there. But it shouldn't be because it affects the health system. All stakeholders have to collaborate, have to partner, strengthen their partnerships so that there can be better health outcomes. So To wrap it up, today we've learned a lot. We've seen that statistics is a powerful tool for understanding health and planning interventions, isn't it? Because data is more than just numbers. Ah, yes, it carries meaning, it carries direction, it even saves lives. Now, we saw that from the descriptive data to inferential data, from categorical to continuous, every type of data has its place. It does. And when used well, statistics can help us save a lot of lives, improve our health systems, and build a very, very, very health society. So if someone next time sees you and says, statistics is just numbers, what do you say? You can confidently tell the person that, yes, these numbers shape the future of health and can save your life. So if you found this video helpful, please give us a thumbs up, go down there, like, subscribe if you haven't yet, and share the video with your friends, with your children. If you have young children in primary school, secondary school, even universities, this video will be very important to them. If you have your nieces, or if you have people in the health sector whom you know are decision makers, are policy makers in Ministry of Health, in the CDCs, in the teaching hospitals, share the video with them, with politicians, share the video with them, and so that together we can build a stronger society. Because here on IFL-SC Global Academy, we will always continue to educate, inform, inspire leaders who can combine knowledge with action. We don't just want knowledge, we want knowledge with action. We want to say together we can build a safer world and a healthier world. I am Marie. Who are you? See you next time in my next episode. Bye for now.